And so that's where in your book you discuss the palliative care. And I think that you also talk about how few palliative care doctors there are and what a need there is there. So I think that for many people, they may not have ever heard that term. They may not know what that means. Everybody knows what hospice means, but I want you to explain the difference between palliative care and hospice care.
Certainly. Briefly, hospice care is actually a Medicare benefit that is available to anyone who has Medicare who qualifies for it. It usually, or not just usually, but it does specifically imply that this is someone who has an advanced disease or condition with a prognosis of 6 months or less. Now, I will tell you, and you will certainly appreciate this, prognosticating is fairly accurate, but it's not that accurate either. You know, we'll sometimes think that someone has a 6-month prognosis and they dead in 6 weeks. Or we may think they have a 6-month prognosis and they can continue for 2 or 3 years. But it's a good faith estimate of say 6 months. So someone who's eligible for hospice, they get comfort care. And hospice is a beautiful concept. It's been around for decades, for many years, started in the UK. And it is something people do either from home or in a hospice setting. Now, palliative care is kind of a first cousin to hospice, and it is sometimes what I call the precursor of hospice, in that it is given to people who have a serious life-limiting condition that may have a prognosis of way beyond 6 months. But these patients are often getting active treatment either for chemotherapy, for congestive heart failure, for emphysema, for diabetic complications, who are suffering. But they are now eligible, they can become eligible for palliative care, which is similar to hospice care, but it is a team approach. And when I say it's a team approach, it's a physician, there's a pastor, there's a social worker, there is a pharmacist, to talk to the patient and family about saying, okay, where are we at? What are your goals of care? And this is a key phrase we use. What do you want? We know that you have a bad condition, but let's talk about what if things don't go well? Let's talk about how we can support you, how we can help you, how we can help your symptoms. Let's talk about if you're having pain, let's help you with that. If you're constantly nauseated, let's say from the chemo, we can help you with that. If you're feeling anxiety, we can help you with that. And it's a team approach to symptom management, which is a beautiful concept, because very often the people who treat the condition, like the oncologist or the cardiologist, are so focused on the heart or the cancer cells that they forget about this is also a person who has feelings, who has other complaints that need to be addressed to not just to make them more comfortable, but to make them feel more dignified and improve their quality of life.
Starting your route to retirement.